You're fine. Good morning, everyone. We'll start with the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. We'll have the invocation by Faith Chapel.
Heavenly Father, we thank you for the leadership that you give in this county, Lord. We thank you for the wisdom that you give them to handle all the business thereof. And Father, we just ask that you would just continue to give good grace and good favor and blessings in this county. In Jesus' name, amen.
I'll make a motion. We approve the minutes from June 9th, 2026.
Second that motion.
It's been moved and seconded. Any further discussion? All in favor say aye.
Aye.
I'll make a motion. We approve the claims in the amount of $464,926.64.
I'll second that motion.
It's been moved and seconded. All in favor say aye.
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 There's another small one or something. Or is that total?
We have adds and abates. Is that what you're talking about?
No,
There's
go
two
back to
on
the
there, I
claims. I
think.
think there's two of them actually there.
Okay.
500 maybe.
It's already pre-added.
I have $80 one separately.
Yeah.
Okay. I'll make a motion. We approve the claims for $80 for start date 6/12 through 6/12.
I'll second that motion.
It's been moved and seconded. All in favor say aye.
Aye.
Aye. Make a motion. We approve add and abates 2025-00321 and 2025-00322 in the amount of $214.14. That's my motion.
I'll second that motion.
It's been moved and seconded. All in favor say aye.
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 Ally still needs to sign the one.
Here's, I signed both of those. I know we only have to sign the front page, but there's only two. Any changes to the agenda this morning? You have anything? Okay, we have one 15-minute anticipation of litigation, 75-4319 B2 for 15 minutes. So with the commissioners and the attorney. That's all I have this morning. I'll make a motion. We approve the agenda with that change.
I'll second it.
Been moved and seconded. Any further discussion? All in favor say aye.
Aye.
AMR, ready?
Good morning, Don Brooks with AMR. I've got the monthly report from June 1 through 14. Blue Mound were 8 calls and 3 transports. Centerville 5 calls, 2 transports. Lacine 53 calls, 12 transports. Fulton 2 calls, 0 transports. Mound City 27 calls, 9 transports. Pleasanton 27 calls, 9 transports. Prescott 10 calls, 2 transports, a total of 140 responses for calls and 34 transports.
Thank you.
Yep.
Thank you, Dawn.
Sheriff's report.
I have it pulled up.
Go ahead.
Sheriff's report for June 15th. Total prisoners is 62, 18 releases this past week. Total prisoners in is 62. Total farmed out 0. Total farmed in of 38. 911 calls of 71. Jail contacts 4,795. Total calls for service of 715. Civil service papers served of 28. VIN inspections 12. New cases opened 41. Cases closed 24. Vehicle crashes 10. Bailiff contacts 145 with 81 resulting in calls for service. 6 livestock out.
Brian, Fire Chief.
Morning, Commissioners. Brian Schroer, Linn County Rural Fire. Last week, we had a total of 7 calls. We had 1 gas leak, 2 storm watches, 2 motor vehicle accidents, and 2 EMS assist. We also, over the weekend, had some firefighters attend a fire school in Caney, Kansas. There's another one coming up in Girard that I think we'll have some people going to as well. So,
Okay, perfect.
Good.
Thanks, Brian.
anything else?
I don't have anything. Linda, emergency management.
Good morning.
Good
Linda
morning.
Simons, Emergency Management. I don't have a whole lot going on. We don't respond typically, so I don't have a call number, but I worked on the EOP and the debris management plan along with the emergency management with the EOP mapper, which is the state mapping program that they require us to do. I've been working on that. I had talked to Chastity because she takes the reservations for the fairgrounds. And so she's going to let me know when they have large groups down there. And so we did have a large group at the fairgrounds this weekend. And so I had sent out an email, and this is what I'll do to AMR, sheriff, fire, dispatch, just to alert them that there are people at the fairgrounds. So I know the sheriff and Brian both went down and checked with them about what they were going to do in severe weather and made sure Bunker Hill was open. So if they needed to shelter, they could. And that's something we'll just try to keep done so that everybody's aware there's a group down there. I attended the department head meeting, which went well. That's about it.
Okay.
Any questions?
Nope.
Sounds good.
Thank you, Linda.
Thanks, Linda. Jesse, Public Works.
Morning, Commissioners. Jesse with Public Works. I sent out our proof of loss statement from the insurance company for the rest of the monies we're going to receive from them so we can finish paying our contractor. Sent that out. Hope you've had time to review that and look over that. If you're okay with that, we'll get that signed and sent back to them.
$10,953.
Yes.
Are we still gonna owe another 51,000 on the pending?
No.
You see what I'm talking about though?
Yes.
Okay.
Mhm.
Commissioners, do you have an issue with it?
I'm good with it.
I'll make a motion. We approve the supplemental claim in the amount of $10,953.92.
I'll second it.
It's been moved and seconded. Any further discussion? All in favor say aye.
Aye.
Do you have that printed out?
I do.
One. Do we need to sign it or no?
I just need to sign it and send it back
Okay.
to them. Next, I've got a burial permit, BP 2026-06. This is for Hettinger Excavation. They're going to be crossing up by Linn Valley. They have paid their fee. It's on Ury Road and 2400 Road. They'll be crossing on the north side of that intersection, boring the road. They'll be casing it. And there's no obstacles that we're going to have to deal with there for them.
I'll make a motion, we approve BP 2026-06 for Hettinger Excavating.
I'll second that motion.
It's been moved and seconded. All in favor say aye.
Aye.
Just so you're aware, I did find someone to help give us a cost with the acquisitions for property around the old military bridge. He's going to look at that, give us an estimated cost, what we're going to look at on that bridge, just so you're aware of that.
For the purchase of the ground.
Yes. Hopefully I'll hear back from him later this week on that. The only other thing I have is I'd like to approve overtime again for the crews to be out working on roads. We were out most of the weekend removing trees and fixing roads and putting signs up for high water that was crossing the roads. So that's the only other thing I have for you.
I'm good with it.
I am too.
Same.
All right. Thank you. If you have any questions for me.
Nope. Thank you, Jesse.
Thanks, Jesse. Have a good week. Clerk, we'll go ahead and do, I'm ready if you.
Yeah, he's part of my thing too here.
James?
Yeah, he's got a resolution, so we'll start with him and then we'll go into election thing.
Good morning.
Sheriff Hakes, Linn County. I got a resolution request. I talked to Chastity about it. Got two vehicles over there. One's a 2020 Ford Explorer. We've got mechanical issues with it. The other one's a 2022 Dodge Durango. We also have mechanical issues with it. The explanations down below it of the Durango. The only thing I request, the other thing I request is the funds go into the general fund. We don't have any projects or anything we need the funds for. We will sell it to the highest bidder on the auction website, GovDeals. And that's currently what I have for those two.
I'll make a motion that we approve the surplus inventory resolution.
All second. It's been moved and seconded. Any further discussion? All in favor say aye.
Aye.
So the next thing I have, on or around August 15th, we were going to do a fundraiser for our Sheriff's Office North Pole Patrol. The North Pole Patrol provides necessary items to school kids for winter, like jackets, hats, coats, and then if there's funds left, they're allowed to pick, a toy. And we work with the schools, school resource officers, get with the schools, and we put this program together. We have, what I'm requesting is that we use the east side of the courthouse, the old courthouse. We'll have two inflatables, and then we're going to grill hot dogs and chips, and it's going to be free will donation. Everything's going to be paid for with outside donations, so there'll be no expense to the sheriff's office. It's all volunteer. We're going to ask the fire department to bring their trucks down, and anybody else that wants to come down also. And we figured we'd run it from about 4 to 8, 4 to 7, something like that. And we're kind of working the bugs out, but the best place that we saw for it, including being August, is the east side lawn of the old courthouse. There's plenty of parking over there, shade, anything like that. So that's what we're asking for right now. If we could use that, we use that lawn over there. But
I'm good with it.
I don't have an issue.
okay, so I'll give you a report back and let you know how successful the community engagement is. We'll also have on that, we're trying to hit it right before school starts, after the fair, and we're going to try to get some other people together, like our community support, as far as our information packets on the scams for the elderly and things like that. The same thing we do for our night out against crime, and we do it down at the Arts and Crafts Festival also. So other than that, that's what I have today. You guys have any questions?
I don't.
No? Okay.
Sounds good.
Thank you.
Thank you.
Thank
Have
you.
a good week. You want to do your?
Yep. Good morning, Commissioners. I am Chris Kurland with Election Systems and Software based out of Omaha, Nebraska. And I was going to talk to you this morning about the election equipment and what it looks like in the future for Linn County. And before I get started, I just want to say thank you to Linn County because you're one of our longest customers that we've had. Our company started in Omaha in 1979, and Linn County has been a customer of ours since the early 80s. So you've been great customers. Shasty's been great to work with. You guys have just been fantastic, so we want to thank you. So what I'm going to show you today is going to be the newer generation of equipment that you'll have next after the current election equipment that you're using right now. And I'm going to go over to the equipment and kind of show you some of the new features that are coming for you folks. So thank you. So right now, the equipment that you have looks very, very similar to this. The difference between this equipment and what you currently have is this equipment that I'm showing you today is up to the standards of what we call VVSG 2.0, and that's the federal government's new voting standards that are coming into effect. So the equipment you have now is the old standards. Well, the federal government made some changes and said, hey, here's some of the new security features that have to be included in all election equipment going forward. So I'll go through and point out what these features are, and this is what Linn County will eventually go to when Shasta makes the decision to buy new equipment. So you see two things sitting here. The first one, we call this, this is called the Express Vote. The easiest way to think about this machine is this is just a giant 22-pound pencil. And the reason why I say that is because this machine does nothing more than marks a ballot. It uses a different type of ballot in this machine. This is the ADA device. So if a voter comes in that's blind, for example, they can use this machine with headphones, and it's constantly talking to them. In addition to the headphones, there's a little panel here in the back that comes off, and a blind voter can control their ballot using this keypad that has braille. And it also has the ability to black out the screen. So if I was a blind voter and I was in front of the screen, I could darken the screen and somebody behind me wouldn't be able to see what I'm doing. Another nice feature that you currently have on your current equipment too is we use thermal cards in this machine. The reason why that's important is whatever Shasta doesn't use in an election, it's blank, so she can reuse in the future election. Whereas the normal ballot, like this, she has to destroy these after the election. So these are like 25 cents a ballot, so it's a waste of money for Linn County. Whereas these, whatever's not used, she's going to reuse in the future election. So kind of a nice feature. So just to briefly talk about the Express Vote and run through some of the new features. The screen, this is an improved screen. The screens you guys are using now is kind of an older technology where it's a little bit more sensitive to the touch, where you have to press a little harder. These screens, the best way to describe it now that you folks will understand is this is more like an iPad screen. Much easier to use, much easier to interact with. The way it works, in case any of you haven't seen it before, you put your card in, hold up the ballot for the voter, Voter comes up, makes their selections. They can do write-ins as well on this. As soon as they're done, they hit next. It gives the voter a review screen, so that way they can make changes or go back. If they're happy with what they see, they can print their card. It prints out, doesn't take any ink, it's all thermal. The machines you're currently using are also thermal. Prints out the voter selections on the card, and nothing's been counted yet, because if I'm the voter, I can still look at this and say, yep, that's correct. And then I would walk over to this machine, which is called the DS300. And right now you're currently using the DS200 that counts your vote. So then the voter would come over, put their card in, takes it in. There's a public count on the screen so the voters can see that, yep, their vote was counted and the public count incremented by 1. Here's some of the features that are coming in the future though, real quick, just to briefly talk about this. So one of the new features that Shasta will have an option to use is called the smart card reader. And what that means is it's dual authentication. So like, just like with a lot of stuff you're using now with like emails and whatnot, you can't just log in anymore. You have to like log in and then go to your cell phone and put in a code. Well, in this case, the poll worker in the morning would open this poll, put in their password, but instead of just going to voting mode, then they have to also insert a smart card. So it's just a way to have, so let's say somebody breaks into your account in the middle of the night, they're not gonna have access to your voting equipment without that smart card, even if they have your passwords. So that's one of the big features coming in the future. Another feature on this machine that you currently don't have is this tape, which is only going to be a big deal to Chastity, but she understands. At the end of the night, this prints 5 times quicker than your current equipment. And the reason why that's important is because on election night, when the polls close, county clerks are under immense pressure to get results in before the 10 o'clock news. It's just a fact. And on like an August primary election, this tape that prints, it can take right now up to 10 minutes for her to print that tape. Whereas this new machine will print in like 1 minute, basically. So it's much quicker. Another nice feature is this does have a backup power battery. So if we had a tornado hit right now, the power went out, this machine will still run on backup power for 3 to 4 hours. Another feature that's available that Kansas does not currently use, but will be available in your equipment is we have something called an encoder in these new machines. So let's say Chastity's like, hey, we're going to start doing what's called a risk limiting audit, which is just an audit that some states do after the election. She has the ability, if she wants to turn this on where it'll print a random number on each ballot that goes through it. So that way, if she does that audit after the election, all the ballots have that random number that she can use to go into the system and do what's called a risk limiting audit, just to verify that the election results are the same after the election as they were on election night. So it's just one more added safety feature in the future. Another thing that we've changed, right now your machines are on, they're a little bit more top heavy because this box, as you can see, is pretty rounded and square and has a handle in the back. The ones you're currently using are more this. So if you hit a bump on a sidewalk or something, it can top over because it's just top heavy, and that's something that we changed. Another thing you can see on the back is that handle I just mentioned. So now these roll with a handle on the back because right now there's just no handle. So it's just a little harder to get into the poll sites. And keep in mind that people that use these are usually elderly poll workers. So we made that a little bit easier to use. Another feature we added that you don't have right now is you have a black bag for the express vote, which is this machine. That looks just like this. But now we added this handle on it, so it's more like a suitcase. So it's easier for a poll worker to look to the poll site. So I think there's any other features that I want to bring up that are coming in the future. So another nice feature is the plug on this machine. It just goes directly to the wall to the machine. Right now, the machines you're using, the plug has a big giant power box, and it's a pain in the butt, as you know, I know, Chastity, for the poll workers to plug in. So we had fixed that and made that a lot easier as well. So what's coming down in the future, when your folks are ready to switch, eventually make the change to new equipment, is you'll be certified with the new federal standards, and you're also going to have some of the new safety features that I showed you. And just like Linn County's always had, you'll always have that paper backup of your ballot. Because no matter what happens at the end of the day, Chastity can open this up, and she has all the paper ballots in there at the end of election night. So if anything ever needs to be recounted, you're not just counting on a machine to tell you what the numbers are. She has the actual paper ballots to go back and look if ever needed. So I'm not sure if anybody has any questions or any comments.
The changes were required by federal government.
So these changes are going to be required by the federal government. The government hasn't yet decided on a date when that change will be made. But from our understanding from the EAC, which is the governing body and the feds that actually approves this equipment, they told us that counties are gonna be grandfathered. Where a county like Linn County might say, hey, we don't have the money to change over on this date. Well, our understanding from the feds is you're not gonna have to change over until you're ready. So the equipment you're currently on will be good until you need to change over until the feds tell you you have to make that change. But right now, they haven't given anyone a date, so. And I think they're still trying to figure that out themselves, so. Just to tell you another thing, we will let Linn County operate on the current equipment you have as long as we possibly can. There might come a time where we're like, hey, Shasta, the feds are making you switch over to the new equipment. That date hasn't been given, but it could happen, so.
Okay.
Yeah, well, thank you all very much. I appreciate it. And thanks for being such great customers, such good partners. We appreciate it.
Thank
Thank
you.
you.
And now I'll quietly pack up. Get out.
You're fine.
Thank you, everyone.
I'll make a motion. We go into executive session for job interviews pursuant to Kansas statute 754319B1 for 15 minutes with the 3 commissioners and the interviewee. Returning at 9:43 in the commissioner's annex room. That's my motion.
I'll second it.
It's been moved and seconded. All in favor say aye.
Aye.
Thanks. I'll make a motion, we extend for 10 more minutes to 9:55.
I'll second that motion.
It's been moved and seconded. All in favor, say aye. Aye. Don't take it. There was no action. We'll open up for public comment. If the citizen desiring to speak at this time may do so. Discussion is limited to 5 minutes and the commission will not take action. Items introduced under public comment may become agenda items for a later date and time. Is anyone here for public comment? I'll close public comment. I'll make a motion. We go into executive session for 20 minutes with the 3 commissioners, Chastity, the clerk, and Linda Simons for job interview pursuant to Kansas Statute 754319B1. That's my motion, returning at 10:18.
I'll second it.
It's been moved and seconded. All in favor say aye.
Aye.
Aye. There was no action. Is this Southeast Kansas? Go into that. Are you guys ready? All right, we'll go ahead and have Southeast Kansas Mental Health to the podium. Just introduce yourselves and then who you're with.
Thank you.
Thank you.
Good morning. I'm Doug Wright. I'm the interim CEO for Southeast Kansas Mental Health Center. I have with me Amber Morrison, who's serving as our Chief Financial Officer. Appreciate you guys letting us come and talk. I think the commission's probably pretty aware of some of the changes within our organization. Obviously, last year you chose not to fund us, and a lot of that was related to salaries and kind of things that were happening at the organization. So I want to highlight some of the changes that have happened. We have separated from doing primary care, so Ashley Clinic's no longer part of our organization. We've also separated from dental, so we are just a community mental health center, CCBHC, only doing mental health, substance abuse type of treatment. Since being brought on in an interim role in end of January, 1st of February, we've made a lot of other changes related to salaries. One of the things that we were focused on doing is making sure none of our staff were the highest paid in Kansas, looking at other community mental health centers. So comparing apples to apples versus some of the other comparisons that have been made with past cost studies. And so at this time, none of our staff from management on down are the highest paid in the state compared to others. For upper management, that meant pretty large cuts, 30-40%, sometimes higher. My total compensation from COO was 51% reduction. So get us back in line with where other mental health centers, I think, was kind of an important step. But with all of those changes, we also were faced with needing to repay the state some funding. And so we're under a structured repayment plan, which has made our finances much tighter. And so even with the executive cuts, we had to make a 12.5% across the board staff salary reduction just to sort of stabilize the ship, which we've done. And we'll be making that payment over the next year. But we are still able to provide all the mental health services that we did. All of the enhanced services that came about with CCBHC, such as medication-assisted treatment, some of our ACT team crisis services, all of those enhanced services since we became a CCBHC remain intact for all of our counties. So we don't really foresee any changes with that. Here in Linn County, our services have continued to grow. In the last year, we provided a little over $171,000, as you'll see on your sheet, in indigent services. So as a CMHC, we're formed by the counties. There's not necessarily a funding requirement, as you know, for counties. But what we can do is use those county funds to offset some of our costs that aren't covered by CCBHC, such as services for the indigent. That's why we highlight that there, as well as a lot of our crisis services. If a person has Medicaid and is in crisis, those services are covered by CCBHC funding. But if they don't, if they're indigent, or even a lot of private insurances, they don't cover crisis services. It's an excluded. And so that's where we look for other funding resources, such as from counties. And so with the changes we've made, we would ask that the commission consider restoring our funding to what it was the previous year, which was about $68,000. But that's really kind of the overview. I think that kind of highlights a lot of the changes within our organization. But I'm happy to answer any questions any of you might have.
I don't have any questions.
Do you have any questions?
I don't think I do right now.
Are you guys still involved with coming to, I was just trying to look at the minutes, but it won't open up. But we had started to have meetings where we were helping homelessness in Linn County, and Southeast Kansas Mental Health had started to kind of go to those meetings at the church. I didn't know if you guys are still doing
I
that.
believe, yeah,
Yeah, I thought-
if they're the ones I'm thinking of.
I was
yeah.
trying to look at if
Yes.
she was still in attendance, but the PDF wouldn't open, so I apologize. But appreciate you
believe
guys
we
doing
are,
that.
the ones
It's
I'm
been
thinking
really
of.
productive within the county, and
Yeah, and I think homelessness is an important issue in rural areas. I think often we don't think there's that many homeless because it's not like, a major city where you see people camped out, but we have a lot of precariously housed people within our counties that sort of, I call it couch surf. They're at this place and then they're at that place and then maybe they're not in a place. So I think that's an important issue. And I think the economics of our rural counties have increased some of the homelessness here. So I think it's an important issue. So if we haven't been, I want to make sure we
no,
are.
I just was
Yeah.
wondering. Have other counties ever allocated the fund? Can the counties allocate what you do with the funds? You're requesting $68,000. Does it just go to indigent persons, or can we allocate where you guys use those funds?
They have not, but I don't know that that means that they can't.
Okay.
I would assume that they could in some ways.
Okay.
I know that we would have to make sure they aren't going to like the Medicaid funds because as CCBHC, that's meant to be cost-based and cover that. So it would have to be we'd have to apply those somehow for non-Medicaid, but I don't think, do you know any requirements that says they couldn't? I'm not aware of anything that says you can't, so.
Because all of that's, it's volunteer for all of our communities. So I was just wondering if that's something we could help out with allocating some of those funds.
Yeah.
It's definitely a discussion. Probably have more questions later.
All right. Any other questions?
I don't think I have any.
I don't know.
Thank you.
Thank
All
so
right, well,
much
thank
for
you.
coming in.
Appreciate it.
Thanks. Have a good day. You want to go into insurance?
I sent you some documents last Friday, I believe it was, talking about insurance. With Jen Elliott on the phone last week in regards to our options of staying with Blue Cross and Blue Shield versus potentially moving to Allied with a different potential insurance coverage plan and prescription plan. And as I mentioned before, I've had several employees reach out prior to the process of looking at insurance, stating that they were adamant about wanting to keep the current coverage that we have. So I also brought up last week, as did Jacqueline and Jen, in regards to a couple employees previously last year mentioned that they would be willing to maybe pay for part of the premium. And the document that I sent to you just kind of gave a breakdown of what that would potentially look like if we charge the employees 10%. So if you don't remember, the cost is going to go for an employee only to $937.48 for the premium. For an employee and spouse is going to go to $1,941.71. For an employee with just children is going to go to $1,832.13. And an employee with family is going to go to $2,836.37.
And you're referring to that increase based on column number 1, column number 2 on the renewal?
Of what the new, yes. Mhm.
Did you do column number 3,
Which is,
The 100,000.
100,000 for the?
Specific.
this is with the 100,000.
This is
Oh,
the
so this
100,000.
is column 3.
Column
Yes,
three.
I apologize. Yes, this is with the 100,000 stop loss, correct.
I didn't print that off.
This is from last week.
I know.
Okay, so the new rate
That's right. I don't think that'd be
is
good.
column 3.
Yep.
There we go.
Somewhere there.
I'll do somewhere on there.
So you're saying the $100 is just something you
That's
put in there?
column 3.
So
Cover
the
it.
$100 is, so I don't know exactly how every other business does it, but most businesses there is a percentage that the employee pays per pay period to help offset those costs. The employer pays a large portion of that. Then, of course, it increases whether you have a spouse, a child, or, as a family. Currently, what happens is if you do the trifold, what we call the incentive, and you go to get your physical and do those sorts of things, get those 10 points, your insurance can cost anywhere from $50 to $150, depending on which category you're in: employee only, employee children, employee spouse, and employee family. We have 31 employees that do not do anything with the trifold, so they do not take the incentive. It just costs the county full amount of that insurance. So,
Okay, so my question would just been on the employee only, it's $50 on the current. And it's $50 with is that incentive on current, on the $50? This is at the top.
yes,
So that's $50 with incentive, and you're saying you can stay at $50 with incentive down here. That's the potential new rate. There's no new rate. It's staying the same. Now, the potential new rate with employee with children would go from 62 to 183.
correct.
Why is there such a large increase
Because
on
of the
those?
percentages. Because of the percentage of, it's $2,836.37.
So let me make sure I understand you, Chastity. You're saying if they do not do the trifold, the county picks up the,
The employee pays a minimal amount. So
What-
we have, for instance, we have an individual that pays the premium. And I will say the document that we looked at from last year is not an accurate document, because these figures only showed the cost share, or the stop loss fees. They did not show everything that's included, which is why I tried to include everything in that document that Jason's looking at shares. And I think I shared that with you guys in an email as well. Let me pull that email up.
I guess I was just confused on why employee only, they increased $200 as well, over 200. Or I guess 200-ish. They didn't have an increase. You kept that at 50.
Because normally most companies, I shouldn't say most companies, but a lot of companies will pay the full amount for an employee, or if it's an employee only. Like when I worked at the school, I didn't pay a premium at all, nothing. The school paid for mine. But if I took out insurance on my children and or my spouse, then there was a large amount that come out of my paycheck.
So you're switching that based on not percentages.
Correct.
You're switching that
That's
based
just-
on how you think it should be.
Just that's how it was if they did that's what they were doing currently with the trifold.
Okay.
The other thing that I want you to think about is we have some employees that have only take our insurance because it's offered to them, but they do have an opportunity to get insurance with their spouse. So that's something else that you could think about is, would you like to give them an incentive, an employee an incentive, that if they don't take our insurance and can be on their spouses, maybe you gave them an incentive dollar amount. I know that a surrounding school near us does that.
So
And
like
it saves money.
Sounds-
$50.
Sounds complicated.
This whole insurance process is complicated, not gonna lie.
Well, the only ones that would be interested in doing that would be employee only, right?
No, not necessarily. It could be any of our employees. Right now, you have a lot of individuals that take our insurance because it literally costs them minimal amount or nothing. And even with the amounts that I gave you, that I provided for you that could potentially be used, they are still a dramatic drop compared to what most people pay at another employment or even another county. I shared last week that I've reached out to numerous counties and their employees pay a chunk of their premium. This is truly just a recommendation. It is your call. I just know that dollar figures are really going to start making a difference when it comes to the budget.
How much does it increase if we go to the 100,000 and continue where we're at? Do we know a dollar figure as far as for everyone that's involved right now?
Of what our dollar figure will look, it's on that sheet that you're looking at right now. It's going to go from 2.4 to 2.6.
2.6, okay, I see that. Yeah. This is gonna cost us 180,000, roughly 80.
Yep. Yes.
187.
Yep. And that's moving it to the $100,000 from the $75,000.
Mm-hmm. Moving it from 75 to 100,000, yes. And I'll be honest, charging the employees the amount that I've shared is not going to make or break what the county is currently paying. It's not going to make or break. But insurance is going to continue to go up.
My feeling is that we need to switch to the Allied Everlong policy that's keeping us closer or just under break even. The column 4.
With that, Jason, are you also implying that nothing changes for our employees in what they pay?
Yes.
We just continue paying the way we pay now and just switch insurance companies is what you're saying. So leave her.
And if we stick with column 3, Blue Cross and Blue Shield, and same $50,
What we
the
currently
same
pay?
what we currently are paying, it will cost the county $187,000.
An additional.
Okay. Jim, do you have any comments?
We ask them to pick up the difference. What's it gonna change their?
Oh, far drastically than what I shared with you. The document that I shared with you that has the 3 colored columns,
Right.
you go to the bottom, that's what you're going to gain from them. You go to the bottom blue. If they continue to do the trifold, that's what you're going to gain from them. If they don't do the trifold, it's in that purplish pink color. If we turn around and put that amount on the employees, it's going to. I have received a couple emails already in frustration that we want to increase the employees'
Contribution.
premium. Mm-hmm.
My understanding from the previous communication that we had with the employees was that we were going to unilaterally make a decision and that we did not give them the option to pay a little bit more to keep the exact same benefits that they had. And so to the extent that you all are considering making a change to the insurance in general in order to save money because it has become cost prohibitive, I do think that even if you sent an email to the department heads to inquire of their folks that are under them, what their preference would be, because also the cost of this is gonna ultimately affect the county's budget in terms of a mill levy increase too. So when you face the budget hearings and the people asking the questions are gonna ask whether you considered all things, when you reach.
Offsetting the cost to the employee
Exa-
versus,
Exactly, and so I think no matter what you do, not everybody is gonna be happy.
right.
But it seems to make sense for mitigating frustration to at least inquire, especially to the extent that you're considering a change. If you're not considering a change, if you're considering leaving everything exactly the same and the county's just gonna eat the difference, then you just need to be prepared to answer the public for why you're not gonna, make a change. If you are considering making a change, whatever that change would be, if you were to limit it to two choices, for example, we'll keep what we have, but the employee contribution is going up, or we're not keeping what we have and we're switching to this other thing altogether. Those are the options. And even if it would be difficult to have that conversation with every employee, perhaps it wouldn't be as difficult to have it with the department heads.
And I'll just,
Well, I've already been reached out by a ton of people because the email that went out to every employee has people in the county concerned. And I felt like I received a lot of phone calls over this for no reason yet. And I just want to state that we haven't made a decision on anything. And moving forward, I didn't want to get in a position that we got into last year, with giving too much information sometimes of not needed. So I haven't made a decision. We haven't made a decision.
the decision has to be made today.
So, well, we don't have enough time to. Okay.
We have to go Thursday to open.
We
enrollment.
received all of this information last week, so I guess if you guys are ready to make a decision, that's fine.
I don't want to be in this position again next year in regards to waiting to the last minute. You got the information when I got the information. I have inquired and asked some employees to be on potentially a team that we can start this process in January and February versus waiting until April and May. And we also have to submit a document to USI. It's an audit of some sort that has to be provided, and they don't get that. They don't even request that until May. So my goal is to move this process up sooner than waiting until this last minute. But we have to have a decision because we have to go into enrollment on Thursday. So we have to know, the employees need to know which route they're going to go. And I do not like this any more than you guys do of making this decision. Overall, you're looking at a 7.8% or 7.6% increase by going to that $100,000 stop loss and staying with the current insurance policy that you have of the Blue Cross Blue Shield of Kansas. Or as Jason mentioned, you have no increase whatsoever by joining the Allied Everlong. We are being told the Allied is similar to Blue Cross Blue Shield. We don't know that 100%.
Okay, I don't know a lot about Allied. I've never heard of Allied. Just quick Google search. They're frequently cited for claim denials, opaque coverage terms, frustrating customer service. They are a company that typically acts as a third-party administrator for self-funded plans. Users often experience confusion regarding billing and provider networks. That was the first
Mhm.
paragraph, so. Um. Let's see, Everlong, I'll look up Everlong, I don't know about.
Everlong is not actually an insurance company. It is like a pool thing of a captive. It's called captive, and it's
Yeah, I remember talking about that.
something more of a pool thing.
Some of the reviews. Have you looked at the reviews on UMR? It just says kind of the same thing.
Mhm.
Not standard insurance companies. Everlong is a company that is self-funded employee health plans for employers. UMR is a third-party administrator owned by United Healthcare that processes the claims and administers the networks for those plans. And let me look under Illuminator.
As I mentioned, as Ali's looking that up, I just want to remind you that as I was doing these figures, I did a 10% fee to the employee for their insurance. Maybe an option is 5%, and the county absorbs the 2.6%. This is not in stone. This is, this was just a recommendation.
But we didn't do that percentage on employee only. We kept it the same.
Correct. Because it is about the same, Ally. It would be 93.74 or 93.75, $93.75.
93.
And so if they did the incentive, it would be $50.
How long have the 50, 62, 70, 100, how long has that been in place? How many years?
That's that incentive with the trifold. I personally don't know. Jim, has that been here the whole time you've been here, the trifold thing? And obviously that's a component to be a proactive versus a reactive. They want individuals to go and get those physicals and those things. So if something is potentially wrong, they can be caught sooner than later. So it's used as a proactive precaution versus a reactive. And as I mentioned, we only have 31 employees out of 135 employees that do not do that. They don't take part in that at all.
And that costs us more money when we do not.
Well, not necessarily. It's just they don't, it does a little bit, yes.
Chastity, are you saying you get some sort of benefit for the employees who do participate in the trifold thing?
We do not from our USI. That is just something the county had set up for the employees to
Okay.
pay less.
So in which way does those employees who do not participate in the trifold cost the county more money?
Those individuals that do not do that are employee only, and all of their insurance is paid for. So it's all of those that have children and or a spouse or family that it saves the employee money versus the county money. Does that make sense? So
I guess I was just clarifying your previous question, that it does cost the county a little bit more money if people don't participate in.
yeah, it's not
trifold.
really, it doesn't, because I was thinking it included employee, children, but I'm looking at the list here. It's only those that have employee only, they receive, or it doesn't, they don't get a cut, I guess, in pay, or they don't pay anything extra because it's all included from the county's insurance.
Do you remember how much last year it increased to the 2.4 million from last year? How many hundreds of thousands of dollars that increased, and we didn't make a change last year? Do you remember?
No, but I can see if I can find something.
I think easy is just like in the budget, but I just didn't see the 2020
Right.
4 or 5. So I'm not afraid to make a decision to go to a different company. However, with the reviews that I'm reading, I want to be solid on my decision and ready to answer to the employees. And so that's why I feel like I'm leaning towards sticking with Blue Cross and Blue Shield.
Okay.
You have experience with
I know. Do you have any? I mean, obviously, we're just looking at it from a financial standpoint at this point, and I totally agree with you, Jason. It looks like we could stay the same. Nothing increases. Everything's great. But then we switch to a company that I'm not familiar with any of them, honestly. UMR being part of United Healthcare, yes, but I'm not sure I have enough information to make that change for the entire county.
That's the only one that I have
Okay.
anything is United Healthcare,
Okay.
because that's who my insurance is through.
That's number 6 is part of United Healthcare.
And what she said last week was the one that more closely mirrored our Blue Cross and Blue Shield was the Allied number 4.
Yeah.
That's what the,
That's what
Jen
Jen said last week.
right.
I'm not finding anything in the emails before my time here, so I apologize, I can't answer the question for you. Would you be, as we've seen on the documentation, the increase is going to be 7.6%. Would you be interested in seeing the employees pay the 7% versus 10%, where it stays quote unquote more or less the same?
I don't like the percentage. I wrote down, I'm interested in looking at the cost benefit with incentive from, let me pull this back up, hold on. Employee only from 50 to 75. Employee with children 62 to 100. Employee spouse 70 to 125. And family 100 to 150. Without incentive, employee only 100. Without incentive, employee children 125. Employee spouse 150 without incentive, and without incentive for family 175. I don't like how, to me it didn't seem, I understand it didn't increase as much, but it increased $169 for employee only, and we left them at $50. It increased $302, and then from last year this year, and then we increased them to 137, or no, 183. Sorry, that's just a.
So again, that's a percentage, and that is putting the employee responsible for that 10%, where what you just described, you're putting the employee themselves without the family, spouse, or children is responsible for more funds than that has a family.
Say that again?
So the figures that I gave you include they are a percentage per the premium, with the exception of the employee. Because honestly, the employee only, most companies, like I mentioned, the company pays for the employee only. It's when the employee chooses to add their spouse, their children, or their family that they then start being charged a premium. I kept it as the employee paying a small portion, so they're held accountable as well for their insurance. The way you described it, and I totally get what you're doing, because that's just exactly the way it had been, and you're just increasing it a little bit. But what you're doing is you're making the employee more responsible. The employee by themselves is technically paying quite a bit more than, because when I see a family, you're saying.
Well, no, because 10% is $93, and I'm saying 75.
I understand that. But overall, look at the family. If the family's only paying $175 when they could be potentially paying $283.
$283 every 2 weeks.
It's $212 every 2 weeks. Or $141 if they do the incentive every 2 weeks. And this affects me. I mean, this is my husband and my children. I'm going to be paying that $141.82 every 2 weeks because I have a family insurance.
Well, it affects everyone.
Yeah, no, I understand that. But I
County.
an employee said to me, "This isn't even going to affect you and your family." Yes, it does. It does affect me because they thought I was just an employee-only insurance.
Okay.
What would you like to see, Jim?
I don't know anything about the Allied. I mean, that's the whole situation there. You know, if the employees would accept a little bit of the cost and, you know, they're willing to stay there, I would be willing to stay with Blue Cross and Blue Shield, but you know, this is a huge chunk of money, and even though it's the same benefit they have, but then everybody's got to keep in mind too, when it comes raise time, that, you know, we gave quite a bit of raise here too. Is the way I look at it, is if we consume it all ourselves.
Right.
I mean, it has to be a give and take both ways, I guess is what I'm saying, even though this benefit is going up. And
I just wanted to clarify something, just make sure we're on the same page, because you're saying what I said was more. And that's not true because
Not more. What I'm getting at is that the employee by themselves is paying a larger percentage than an employee with a family, when you're talking about, you're going to take them
a
from
larger percentage.
from $0 to $75.
Okay, but you just said that it's 141, and so when I'm looking at it, it's from 283 down to 175 from what you had, or 150 really if they do the incentive. So 283 down to 150, and then you divide that by 2 pay periods. That's $75 versus 141.
I get that, but so that person, let's just talk about that. If we're saying 141, that's $282 for it with the incentive, and you're only going to charge $185. That's going to cost the county $132, right? Because if you go from 281 and you're going to drop it to 150, that costs the county $132, right?
Yep.
Okay. Then if the employee currently pays absolutely nothing with the incentive, and you're going to take them to $75. So now you're going to.
Current rate says 50 here, so I guess I don't know.
No. That's what I'm getting at. I'm wanting to go to $50, but currently, right now, it is at 0.
Well, it says current 50. Right up here. That's what I'm looking at. It says 50, 62, 70, 100.
That's if they don't do the incentive. Rose just sent me a message and confirmed and said, with the incentive currently, employees for themselves do not pay anything. It would change
That
it to
doesn't say
$50
that anywhere.
If they
because-
do the,
incentive.
Yeah, and so at the top, then I guess what I need to know is at the top where it says current rate per month, those are without incentives.
Yes, and I think, let me get to the right one here. Make sure I have this right.
And I just thought we talked about this at the beginning, and those were with incentives at the top.
Those, yes, they are. I apologize. The first one should be 0.
Okay. That's where I'm like,
Yeah, it should be 0.
on the employee only.
Yes. Because that very top one is 0. The employee only pays absolutely nothing currently.
well, to me, 10%, 76. So they were. Pretty close to where I think it should have been.
75.
Are we 100% sure? 50, 62, 70, 100. Those are all what are the current without incentives. 100%.
Yes.
Okay.
Yes.
With the incentive, what does it drop to
Which one?
on the top current rate per employee? The $50 is zero.
Mm-hmm.
What's the 62 drop to?
It's,
With incentive, is it just $50 every?
no, that, the other three are correct. It's $62, it's $70, and it's $100.
That's with,
The incentive.
so the 51 at the top should have just been a zero.
The 50 should have been zero, correct? Yes. And I do want to remind you, this does include, our current health insurance does include dental, where a lot of companies, dental is a separate component to health insurance with an additional charge. So.
What are you thinking? Still where you're at?
Yep. I'm willing to go to number 3 and have the employees pick up a portion too.
Well, I just feel if it's what they like and they're willing to pick up a portion of it, I'm good with that myself. But, determine what the portion is.
that what you want to do, Ally?
Can you repeat it? I didn't hear you.
To stay with the number 3 and let the employee pick up a portion of the increase.
And that's what I've been kind of doing calculations on, just trying to figure out just a solid $25 increase to everyone and just be done with it. Or if you wanted to do more of a solid, calculation. Do you know where the 62 is 62?
It is, it was it's $120 for employee and spouse.
70.
Right, so that's 35 per pay period, that if they have the incentive, it's 113 with children, so that makes it 3150.
But see, those calculations were done on previous probably things, so we need to kind of redo that probably a little bit.
Yeah, like, I think that's been like that for several years, the way I understand it.
Because in my head, I'm like, hey, let's add $25, but 62 plus 25, I'm just having a hard time with the two. So it's like, this doesn't even make sense. But are we losing money? I don't know on that one, but I would be in favor of increasing $25 to $50. But the only question that we need to answer today would just be if we're staying with 3, right? A vote on that.
I need a vote on that, but you are going to need to let the employees know, because they're going to need to know that as well.
Yep.
Okay, I'm fine with.
So, yeah, just make sure you clarify that for me when you state whatever you're going to do on that $25 that you were just talking about. So are you thinking that with what I had shared on Friday, employee only, you're thinking from going from $0 to $25? And then from employee children from 62, you're going to add $25 to that?
I mean,
that's where your thought was at?
That's my
okay.
But I was kind of just, my numbers, it's 50 without incentive, 50, 112, 120, 150. I don't understand the 112 and 120, so I was just processing that.
If we raise that like we're talking, what percentage of that will be will be hard to figure.
What would be
because
the percentage that would cover? Is that what you're asking?
they would cover? It'd be hard to, you'd have to individually figure it out.
Yeah. I mean, it wouldn't even be 3.5%. I mean, it wouldn't be 5% for sure. It's probably going to be closer to the 2.5% mark, especially for an employee family. Because if you're only going to have an employee family pay $150, but yet their premium's $2,800.
Just clarification on the first part. The employee with children is 62 with the incentive. Is it 112 without? Are we adding $50
Well,
to all 3 of those?
It would be, I don't know, because nobody that has children doesn't do the incentive. We only have employee onlys that have insurance on themselves that don't do that.
The reason why I think that's important is because I don't know right now what the number is. Like, if they don't do the incentive and it's 62 with the incentive and they don't do it, I need to know if it's 150 or if it's.
It's 113, no, let's see, 120.
Because
Maybe
once you have the
$125.
family, we're giving them the health savings money and the employee only. But the employee only, chances are, don't think he needs it. I guess it's
Mhm.
30.
Yep.
The 250 a month.
Wait, the employee with the spouse without incentive is what again?
The employee with
With
spouse, no
Without incentive.
incentive, what do they pay? Is that what you're asking me?
Yeah.
$70. Or no, that's what the
That's with
incentive, I'm
incentive.
sorry. Without the incentive, it is 120.
And then on the family,
Without the incentive, it is 150.
So this raises $50 a month.
and 62 is the, we don't know.
Yeah, and I'm not sure where that 62 comes from, because it's, children is 113, but that doesn't cut, that cut in half is not. Yeah, it is. 31, is that right? 13, 2, no, that's not even $62. So I don't know where those figures come from. That's just what they charged in the past.
If we raised everybody $50 a month at 130,
Be 78,000.
that's what I got. Is my math right?
I think so.
If we're taking raise everybody's $50,
So I just want to clarify that I'm saying this right. So an employee is going to go from nothing to $50. Is that what you're saying?
well, I'm just saying.
I think we're still just talking.
I know, but I'm just making sure that
I'm just saying if we do this and raise them 50, I'm just giving us
Mhm.
50, and you say we have 130?
I think there's 134 employees.
Okay. So if it's 150 times 134, 50 times 134, that's 6,700 a month times 12. They're paying 80,000, 187,000. Is that right? Even if the employee, the incentive is there for them to do the trifold, and then they have the $3,000 to pick up anything that. So to me, that's not really penalizing them. If it just gives them the incentive to go get the trifold.
And like I said, we only have 31 that don't do that, and they're all employees only. They're not an employee with a family that's not taking advantage of that. So
What I'm saying is even at that, they can pick up their money back by doing the trifold and getting their money, because the health savings money, you can roll over, right?
correct.
I'm not upset about that because it probably costs the county $25 to do the blood work.
Yeah, I'm not sure how.
So I'm not worried about that. I think I'm in favor of the increase, but I'm also in favor of increasing it to where it's not just 100% straight across the board, $25, $50. It's more of $25 with incentive for employee only, $75 with incentive for employee and children. That increased from 62 to 75. And then 100 for employee spouse and 125 for family. That's with the incentive. And then without the incentive, $50. for spouse or for employee only, $100 for employee and children, 125 for employee and spouse, and 150 for employee with family. That's without incentive. So it's a $25 increase if you do or if you don't. Is that what it was in the past, do you think? Or close to it? If you do or don't? Do or don't was more of $50, right?
So you're having the employee only with or without an incentive is $50 either way. Is that how you said that?
$25
With incentive, okay.
So if they do it, they're basically getting $25, but that's not how it was in the past. I think it was 50, huh?
I think it, according to Rose, if they did the incentive, they didn't pay anything. The county paid for everything. 0. They paid nothing out of their pocket for insurance.
Wait, what?
If the employee did not do the incentive, they did not pay anything, no matter how they looked, no matter how you looked at it.
Incentive or not, it's free.
Say that again.
Incentive or not,
Yep,
it's free.
it's free. Insurance is free
Insurance is free.
For,
for the employee only.
oh, okay.
And I just want to clarify, Ally, you're saying with the incentive, it would be $25, and if you don't do the incentive, it's $50.
Yeah, that is what I'm saying. I don't know if that's exactly, I guess my only concern with that was with my increases from doing it or not doing the incentive, it's a $25 jump.
Difference.
And I was wondering if those should be $50 jumps and not 25.
Yeah.
This figure here is not figuring our, cost saving, or the money we put in the health savings account either, right? This is just.
No, that does include that, because that money helps pay for our claims and stuff that goes into that account that pays those claims.
Okay, but that is in this total cost, okay.
Wait, what was the clear question? You're talking about the HSA or not?
Yep.
No, not the HSA.
That's what he's
That
asking.
does not- yeah, no, that does not
HSA
include
money
the
is not
HSA.
in there, so
Yeah.
that the person that does not have, it's not costing us the 3,000 because it's above the 3,000. That's what my question is here, right?
No, we don't have an employee that doesn't take the HSA either. Every employee takes the HSA. So.
It's a separate line item, not included in this.
Okay.
Okay, are you ready to make a motion?
I think that we were not all the way together on something, but I guess I can make a motion. Do you agree? Agree. I'll make a motion that we approve the Blue Cross and Blue Shield renewal in the total amount of $2,659,831 with the $100,000 stop loss added, which is an increase of $187,359, with an employee buy-in increase for employee only, not or utilizing the incentive program. For employee only, the cost would be $25. For employee with children, $75. Employee with spouse, $100. Employee with family to $125. And that is utilizing the county incentive program. The new rate without using the incentive program for employee only would be $75. Employee with children, $125. Employee with spouse, $150. Employee with family, $175. That's my motion.
I'll second that motion.
Been moved and seconded. Any further discussion? Did you have any ideas, changes? Are you good with it, John?
I can live with that.
Okay. It's been moved and seconded. All in favor say aye.
Aye.
Aye. Okay. Good. What's the incentive trifolds? Are those only available online to print out? Are they, where can we pick those up at?
We have them in our office,
In
or
the
we can
office?
email them to you.
Okay.
Yep, you want them, just email it to us.
Okay.
But they are on that SharePoint as well that I,
Okay.
on the employee or open enrollment thing.
Okay.
So,
Anybody have any other?
yeah, I've got two more things.
Okay.
One, I have a resolution here of 2026-19. This resolution is for election workers. You signed one last year eliminating the mileage, and I would like to put the mileage back in there. When they did compiled people's comments after they worked the election poll last year, that was the biggest complaint, is people said we have to drive from Parker or North Linn County or South Linn County to bring, and we are required, it is a statute, to have one of each party bring the components back to the office to be able to do our poll numbers and things like that, voting numbers, and I would like for you to put that mileage back in there.
2026-19.
Yes.
I'll make a motion that we approve resolution 2026-19, reinstating the mileage.
Thank you.
I'll second that motion.
It's been moved and seconded. Any further discussion? Do we know how much it's gonna cost the county?
Roughly, it's like $18.90 one way. I
Okay.
believe. So, and that's all we're charging is one way.
One way, okay. It's been moved and seconded. All in favor say aye.
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 It appears Rose has showed up with some information. Did you want to come? Probably some clarification.
Hi, Rose.
Hello, I'm Rose Moeller, Deputy County Clerk. For the incentive for the employees, it is zero. If they do not have the incentive, it's $50.
Okay.
So if they do the incentive now, then they're not paying anything. But if they don't take the incentive, which 31 of them didn't, then they pay the $50, which is $25 a pay period.
So you just increased it a little bit from that, right? You don't want to change that back?
Right.
That's what I'm asking.
Right.
Okay,
That's just,
I think I'm fine with that.
okay. Thank you for that
Just a
clarification. I
clarification.
appreciate it.
okay.
Thanks, Rose.
Thank you, Rose.
You're welcome.
The other thing I have here is just to let you know, Joyce wanted you to know that she had submitted a grant last fall for the general public grant. She requested $92,050 for operating and $15,900 for administrative. My amounts for Blackout are listed below, and the letter verifies they awarded and the grant based on the amounts I submitted at the percentages they provide. So they are going to, they awarded her $46,025 for operating and $12,722 for administrative. And the first one that I mentioned was federal. The second one now that I mentioned is state at $18,410. So she just wanted you to know that the county was awarded grants, so.
Good.
Thank you.
And I think that's all I had today.
So we have a 15-minute executive session left.
Oh, yep, I think that's all I have. I'll make a motion. We go into executive session for 15 minutes, returning at 11:47 to the Commissioners Annex Room with 3 commissioners and the attorney pursuant to Kansas Statute 754319B2 for anticipation of litigation. That's my motion.
I'll second it.
It's been moved and seconded. All in favor say aye.
Aye.
Aye. Will you sign that one separately for her
Sure.
resolution? I said 47, I believe, right? Oh, it's okay. There was no action. Does anybody have anything else for today?
I don't.
I will make a motion to adjourn.
I'll second it.
All in favor, say aye.
Aye.
Aye.